February 10th, 2025. I'm Ward 1 Councilor Bernie Schultz, and I'm joined tonight by Ward 6 City Councilor Derrick Cruz, as well as a host of people to talk about Medicare for all in Massachusetts. So we're hoping for a real lively discussion tonight, and I'll let Derrick carry on right now. Thank you, Derrick.
Thank you, Councilor Schultz. I am Councilor Derrick Cruz, Ward 6. I want to thank Bernie first for letting us commandeer his Ward 1 meeting, his community meeting. Letting me take the reins on anything is a courageous thing to do. So thank you, Bernie. We have some people to recognize. Councilor Beth Walsh is in the House tonight. She is the Chair of Legislative Affairs. They will be taking up our resolution next week, and they will make that determination before City Council. We have a lot of great turnout from the City of Fitchburg here today. Really, thank you so much. Director of Community Development is here, Liz Murphy. Trevor Bonilla, the head of IT. We have Lieutenant Chris Millette from the Fire Department. Travis from the Chamber of Commerce is here. Our former library director, Shirley Bernard, is in the house. So we have, who else? I don't want to forget anyone. And my wife is here, so that's good. So really, thank you all so much for coming. I want to thank our terrific panel for being here. I'm just going to get right introducing them, and we can get right to it. First speaker tonight, all the way down on the left, is Senator Jamie Eldridge. He's joining us from the Middlesex and Worcester District, all the way from Acton. He came all the way to be here in person tonight. He is the sponsor of Medicare for All Massachusetts, the bill we're going to be talking about, which Councilor Schultz and I have filed the resolution to support here in the city of Fitchburg. We have the president of the board of directors of the Massachusetts Nurses Association, Katie Murphy. She's going to speak after Senator Eldridge. Oh, no, Kimberly will go next, and then Katie will go. She's going to provide the patient perspective as a registered nurse. She's on the ground floor. She sees this every day and can provide that patient perspective. And I believe we're going to get into some maternal health from Leominster a little bit.
How can we not?
Yeah. So, as we know, we lost our maternal ward at Leominster. And these things don't happen in a vacuum. They happen in a system that we have built, that we have created, and that I think we are all here because we agree that some changes need to be made to that system. And then the second speaker, we have Kimberly Connors, the Executive Director of MassCare, is here with us today. That's kind of how this started. I'm a big believer in single-payer health care. If I could have that one magic wand wish, it would be equitable, fair health care for everyone in this country that didn't line the pockets of insurance companies, that deny claims for people who are very sick, in some cases dying. Healthcare is a human right, and it's not something that people should be profiteering off of, in my belief. And I think MassCare feels very much the same way. So that's why we are here today. MassCare was launched in 1995. It is a coalition of mass organizations sharing a deep concern about the inequities of our healthcare system. Their mission is to establish a single-payer healthcare system in Massachusetts so that all residents of the Commonwealth will have access to comprehensive, quality, and equitable healthcare, publicly financed and free of out-of-pocket cost at point of care, because it is basic to life and human dignity. So that's why we're here today, and I want to thank all of you for coming. This is a pretty sweet turnout. I'm kind of surprised, honestly. This is awesome. So thank you all for being here, and I also want to thank Dan and everybody at FATV. We are live streaming this right now, and it'll be available on demand for whoever wants to watch it. To my colleagues in the council who are also on legislative affairs, who said you're going to watch it on TV, there will be a quiz, so I hope you're watching. And I've talked long enough, so I'm going to hand it over to Senator Eldridge in 1 second, but I do want to say one more quick thing, and then I'll stop. The murder of United Healthcare's CEO, Brian Thompson, was a terrible, terrible thing that should have never happened. It has sparked a tremendous amount of debate in this country. But it's wrong. But it happens when people are pushed to a place where they can no longer rationalize or comprehend what's happening to them. That is the result of that's violence. And that's what we saw on that day. That young man is going to pay for that dearly. And it's tragic. But we can't be killing each other. We need to be helping each other. And those things start with conversations and dialogue, and that's why we're here. So thank you to my panelists. Thank you all for being here. And on that, Senator Eldridge.
Great. So thank you so much to Councilor Schultz and Councilor Cruz for hosting this forum. And this is a terrific turnout. So thanks everybody for coming out, and very proud to serve with my fellow panelists, Katie Murphy and excuse me, Kimberly Connors, one of my constituents. We've been on many panels together across the state on this issue. But I haven't come out to Fitchburg to speak about this. So Councilor Schultz, thank you for indulging with your regular meeting, and Councilor Cruz, thanks so much for your passion for making healthcare right. And I often find the best part of these discussions or the question and answer. But I do want to explain the legislation that I filed, an act establishing Medicare for all in Massachusetts. But I would say, first of all, from a regional perspective, which I don't think I really have to tell anyone here, but I would just say the district that I represent, just sort of east of here, the Shirley, Ayer, Devons, Littleton area, and then I go into the Wayland, Sudbury area, and then I go south to Hudson, Marlborough. So it's a fairly diverse district from a city, rural town, suburban community perspective. But the Neshoba Valley region, just east of here, of course, was really hit hard by the closure of the Neshoba Valley Medical Center. Worked extremely closely with M&A, and thank you, Katie, for all your advocacy to try to keep the hospital open, as well as Mass Care. And that was a small community hospital that was very, very disappointingly closed. But that wasn't, to what was already mentioned before, wasn't sort of the first loss of healthcare in this region. You have, serious issues that happen with the Fitchburg Hospital, and then the closure of the maternity ward in Leominster Hospital. And what I would suggest is that, there's a reason behind that, putting aside whatever terrible practices were by Stewart Healthcare, is that, if you have a healthcare system based on profit, it's just not as profitable in more working class, less well-off communities. And I say that representing a district where, I have Emerson Hospital in Concord, which is, very different financial footing, very different sort of demographics economically in terms of a higher percentage of people that have private health insurance. And so, that's a hospital that's not at risk of closure, and that's really unacceptable that we have a system that is based on often, the economics of whether health insurance companies are making a profit. To Councilor Cruz's point, what are hospital CEOs doing? I know that I appreciate the work of many hospital CEOs, but I think at the end of the day, they have a bottom line as well. And as much as Massachusetts has, I believe, the best health care in the country, in the world, of course, the question is who has access to it. And as you get further and further away from Boston, the reality is that often the care is not as great. I think the UMass system is doing the best possible job it can, but again, you're seeing even pockets there of, depending on where the hospitals that they own, what is the quality of care and what is the commitment to improving health care. It was just announced in Marlborough, I do represent Marlborough, is that finally UMass is making some investments in the Marlborough Hospital. That's good. But I've been hearing for 20 years about the problems with the Marlborough Hospital that I don't hear from other hospitals in my district. So it really is because of the system we have, and it's a system that has obviously a lot of federal money coming in, but also based on this sort of for-profit model that everyone, whether business owners, whether individuals, have health insurance, and then of course we're the doctors and nurses doing their best, but at the end of the day, those limitations are often by health insurance companies limiting the coverage. Just a small example in my own office is that one of my aides, and state employees generally have very good health insurance, but one of my aides needed to go in for pretty significant dental surgery, and was told because the dental insurance plan is not good, just like most health insurance companies, dental insurance is very poor. he was rejected for the surgery that he needed. So that's just a reality, you know, again, not just for working class people, but for many working middle class people as well. So we really need to create a change, and I think the challenge sort of substantively and politically, which I think it's important to recognize the challenges, is that the challenge is that, yes, while we have a great health insurance system, we don't have a great universal health care system. And so decisions are being made, you know, based on profit and often self-interest. And I think what's particularly frustrating is that actually the universal health care system would save money. It would actually be less expensive than this cobbled together system that we have that is really a remnant of post-World War II, whereas a way to attract workers at a time when it was hard to get workers who were just coming back, many who were coming back from World War II, that's when sort of health insurance was created as an incentive compared to other companies to get people to work for a company. The fact that we still have that system is very troubling. So the challenge is that the Massachusetts legislature and different governors, and very proud of the advances we've made in Massachusetts. I was a state representative when I voted for so-called Romney Care. But the problem is that it maybe guaranteed health insurance, but it didn't guarantee health care for all. And I think that the political challenge, which I made reference to, is that, you know, each year we can pass sort of Band-Aids or work to get some continued or improved coverage or improve the healthcare system. But unless you reform the whole system, you're not going to create quality care. You're not going to address, you know, major concerns, including from doctors and nurses. You're not going to make sure there's equity and that every region has great quality health care as well as hospitals that are fully functioning. And that's why we need this major reform. And I think that's the challenge, and that's really where to get individual communities to endorse this legislation and get behind it really would make a dramatic difference. Because if you want to talk about, you know, sort of financial challenges, often it's the school districts, often it's the cities or towns, their municipal budgets, where they're seeing premiums go up, you know, 15 or 20% every year. And if there's more money going into that to, you know, more often than not pay health insurance companies, that's less money for roads and bridges, that's less money for education, that's less money for you know, protecting open space and other issues.
Thank you, Senator Eldridge. Here, it's our roads that we need some extra money for.
Yes.
100%. We could use some
I will say I'm a big fan of the Fitchburg mayor, and I am on her Facebook page where she deals with comments on the roads every day, no matter the increase in Chapter 90 money. So right. I fully support that. But in terms of what the bill would do is it would create a system of single payer. So what is single payer? It means it's sort of like public education, is that pretty much everyone pays taxes into the public school system. You know, I know there's a mix of where that money comes from, but it guarantees that everyone, you know, has a right to education. And if you move to Fitchburg, if you move to a community, your child has the right to go to a school. And so what the single payer system would do through a couple of payroll taxes and a capital gains tax is it would essentially create a system where there are no health insurance companies, so health insurance companies would cease to exist, and there would be it would be direct reimbursement to the hospital, to the medical practice, to the medical network, to pay for the needs according to what the doctors and nurses think that you need as a patient. So it's obviously a very big change. It's important to remember, though, that how much of everyone's health insurance is already currently subsidized, and that's not just Mass Health, which is about, I think about 2 million Massachusetts residents, so almost a third are on Mass Health. You have Medicare, of course, for seniors, but you have a lot of the health insurance plans that are subsidized in different ways. So it's creating that single payer system, and then there would be a board of trustees that would make decisions on basically what is the quality of care. And I do think that's important because I know, just speaking to some of my smaller communities, is that there are different healthcare challenges. There's different crises in particular regions. I know in the Ayer-Shirley region, very sadly, there has been a significant opioid overdose problem in some of those communities, and just been gone to countless, very sad memorials and gatherings about how to combat substance abuse. Imagine if we had a healthcare system where, whether it's a hospital, whether it's the area doctors, whether it's the, sort of regional state government, whether it's public health, is able to say, look, we've got a public health crisis here around a certain issue. Let's direct more resources to address this, particularly in areas that aren't as well off. And so, in my view, the Board of Trustees would have that power. I mentioned how it would be funded through an employee payroll tax, and I know that sometimes there's questions about that. I think the important thing to realize is that would mean that you would no longer pay premiums, no more co-pays, no more deductibles. And I will say, for a fairly large number of business owners, I'm not saying everybody agrees, but for many business owners, they say, I don't want to be involved in choosing different health insurance plans for my employees. My expertise is as a business owner. I want to run my business and excel at that. And, I am okay to pay this payroll tax to create this system and then not have to worry about those decisions. And again, I recognize there's questions from some members of the business community, but that's actually the model. And of course, this is the model sort of most other developed countries in terms of the healthcare system they have. So that's partly how it would be funded. And I think in my sort of closing comments, because I don't want to take up too much time, is that, putting aside sort of, what's happened in this region, sort of North Central Mass / Neshoba Valley region, is that think about what's just happened in Massachusetts over the past couple of years around healthcare. A local issue, more sort of all of Worcester County, is the .123 health insurance, which was, threatening to just remove their health insurance policies for tens of thousands of residents. I received a lot of emails about that. Think about the fact that was just something that is possible in Massachusetts. Again, the state that arguably has the most protections for healthcare in the country. The closure of one of the children's hospitals in Boston. Just heartbreaking for many families who have children with, very rare diseases or going through some, serious medical challenges. Just the fact that the hospital, very quickly closed and all those patients had to be transferred to another hospital. To the health inequities, you look at, whether it's broken down by race, by ethnicity, by income level, there's massive healthcare inequities in outcomes that's really unacceptable in Massachusetts to exist. And then something that, and I could imagine Katie might talk about this a little bit, but the surveys by doctors and many nurses that are just fed up with the health insurance system, the healthcare system. They're fed up with having to do so much paperwork. They're fed up with saying, well, I believe that my patient needs this treatment, and the health insurance company denies it. And there's an extreme burnout rate, and there's a real challenge to attract more doctors and nurses in Massachusetts and across the country. So they're very sick of the system as well. And I will say there's a growing number, just talking about doctors, there's a growing sort of movement of doctors that are saying we also support single payer as well. So that is, those are some of the crises that Massachusetts is facing. And this is a bill that I have filed now for, I think, 16 years. So we're building support for it. But I do think the more areas of support we have from across the state, individuals, activist groups, obviously city councilors, other municipal officials, business owners, the more we build support for this. And I don't want to talk too much about what's happening at the federal level, but I would just say, if our federal government is moving towards abandoning us in different ways of federal funding, that we need to show leadership more than ever, including around healthcare. And if we have been the leader on healthcare in this country, we need to show that next step of leadership. I think that is single payer and act to establish Medicare for all in Massachusetts. So that's what I'm fighting for. Thank you for coming. And again, thanks to the councilors for having this forum. Looking forward to the discussion.
We'll get to it, yeah. We're going to let the other speakers first, and then we'll...
His area just lost the shoulder hospital.
Yeah.
That's right. Yeah, I mentioned that. Yep.
We're going to have a nice Q&A after before
Thank you.
we let our panelists go. Thank you, Senator Eldridge. I think you hit the nail right on the head there in your closing. Doctors should be the ones and nurses making a decision about the care that patients need, not insurance companies.
Thank
With
you.
that, we will move on to Kimberly Connors, the Executive Director of MassCare.
Thank you. Thank you, Councilor Cruz. I am Kimberly Connors, and I am Director of MassCare. We are an organization that has one issue, changing healthcare in Massachusetts. That's it. That's the only thing we work on. How I got here, I was in academia. I am a Harvard-trained archaeologist. I worked in one of the Harvard Few museums, and I got breast cancer. I found out very quickly, literally on the day that I was told that I actually had it, they sent me to the financial office. It was so evident that my ability to pay was much more important than my prognosis. This followed me as I went through my treatment. I worked through my, everyone's so afraid of losing their health care that all cancer patients work through treatment until we got paid family medical leave here in Massachusetts, something that said on their average that I both worked on. We were waiting we always felt that the insurance companies were waiting for us to die. Because there is a certain percentage that will. And they play that percentage by doing denial after denial. Unknown treatments. This is breast cancer. There was the same treatments. We had very good success rates, but that was not the way the system works. So, one of the things that people think about in Massachusetts is they say, well, don't we already have universal health care? We do not. We have a highest insured rate in the country, 98%. However, that lies about what exactly is going on. Many people are in the connector under the high deductible plans. They're afraid to actually use their insurance, therefore keeping people until they get much more ill and end up having to go to the ER. The cost barriers of the system are sometimes sorry, I just lost it. This affects people, especially people of color, and people in rural areas, and gateway cities more than anyone else, because you have less ability to get healthcare services. And we know that the system that we have right now, we know that Stewart at least killed one patient at St. Elizabeth. I wonder how many people are dying right now because the shoulder is closed. And we don't know how many people are dying in ambulances on the way to UMass Memorial or to Emerson or to Lowell, because that is what people are doing. A lot of people from the shoulder now go to Nashua. That's quite a drive. There is a group called the Center for Health Information Analysis. This is part of the Massachusetts State Public Health, Department of Public Health, and it every year has these reports. Total healthcare expenditures as of last March was $10,264 per individual, not household. So even the babies in the houses are spending over $10,000 in insurance outlays, whether it's through their employer or through the connector or through Mass Health, and it's being spent by the state for these individuals. It's incredibly expensive, what we have right now. And of course, as Senator Eldridge alluded to, last year alone, we lost Kearney Hospital in Dorchester, the largest black and brown community in Boston, neighborhood in Boston. We lost Neshoba Valley, which is very close to here, and 17 northern central Massachusetts towns are now without any health care. And the Leominster Maternity Department right before them. And people are told to, just get in your car and drive to Worcester and have your baby and, on the way. All medicine is currently profit-driven. And I agree, of course, with Derrick. Killing anyone is horrible. No one should murder someone because of health care. But I do understand the frustration that many people feel. Look at how many, let's see, Eric Dixon, it's the first time I looked him up. He's making $3,120,000 per year. That salary has to come out of someone getting health care benefits. And our organization was established when Canada went to their single payer system. The bill is based on the Canadian model, with each province having its own medical health care trust. We really believe that's the way we could do it here too. Just think how much money would have been saved, how many roads could have been built if we had just done that 30 years ago.
Right.
But they did. And we were always told, there'd be death panels and a huge wait to get doctors. I don't know about anyone else, but I'm waiting over 6 months for doctors that I already am on the books. If I had to go to a doctor I was a new patient, I'm a year out. I know that. Viva. We've been getting lots of publicity. We're even in Wicked Local last week. I don't know if that's the best picture of you.
Picture of me than that, Mike.
That was the little son. I have a few. I'll have to send them one. The bill itself would state that the policy of the Commonwealth is to provide equitable access to quality, affordable healthcare services for all its residents as a right, responsive to the needs of the Commonwealth's residents, without co-insurance, co-payments, or deductibles, and to be accountable to its citizens through the healthcare trust. As Senator Eldridge mentions, this is what would happen. There would now be one payer in Massachusetts. That would be the healthcare trust. As we all know, there are so many insurance companies. There are over 480 coders at Mass General. People that just bill. They have from the code, when the doctor has to do the code or the nurse says you're in there. 480 people work just at Mass General alone due to the billing department. Now, we don't want those people to lose their jobs. We want them to work for the healthcare trust instead, and the bill addresses that, and retraining for these employees to stay in the same industry, just with a different employer. There would be no price controls for drug and no out-of-pocket costs for the period at all. You'd have free choice. There'd be no in-network, out-network nuts. Free choice. You get to choose whoever you want to go to, whatever you want to go to. It is, yes, okay. So, everyone would be covered. Massachusetts residents, including unhoused individuals, incarcerated, undocumented residents, must live in Massachusetts and demonstrate the intent to live there. Non-residents who work 20 hours a week or more, like from New Hampshire, they could be covered if they wanted to. And non-residents requiring emergency treatment, like if you go to Canada and you break your leg, they cover you. That same thing would happen here. Emergency care for Massachusetts residents would be provided, and non-emergency care for Massachusetts residents attained out of state. So this would work very similar to how it does now for like Medicare. What we would still have Medicare. I have Medigap. I do not have an Advantage program. I don't recommend them. But I have Medigap, which takes care of the 20%. That would be the Massachusetts Healthcare Trust. If you're younger than Medicare, that would be your insurance, period. There would be nothing else in the state. And then visitors, of course, if they should get ill, they would be covered. It would, this is from our economist, and he says that there would be substantial savings by reducing administrative other waste, and would increase real disposable income for a vast majority of Massachusetts residents. He estimates 30% of what we're currently spending could be saved right off the top, just by doing that. It would be paid for, as Senator Eldridge said, with a W-2 employees. I often said it's very similar to how paid family medical leave is working right now. They paid into it through payroll taxes. It established the trust, and the trust pays people when they need to get paid family medical leave. The same thing would happen here. There would be a time, if you're a wage employee, you would have a 2.5% tax on your income after the first $20,000. The first $20,000 would be exempt. If you're an employer, it would 7.5% of payroll unless you have more than 100 employees, and then it would be 8%. If for the self-employed, 10%, excluding the first 20,000, and on unearned income, the capital gains that Senator Eldridge, it would be 10%, excluding the first 20,000, but it would not include Social Security, SSI, SSDI, and you can read any or defined benefit pension program. So if you are a teacher, your whatever income you get from that small pension that you get would not be taxed. Here's everything it would cover. It is diagnostic, dental, palliative, physical therapy, chiropractic, language interpretation, emergency transportation, long-term, short-term, reproductive health. COVID-19, we made sure that's in there, including long COVID. And we would include hearing for the first time. Hearing, dental, and vision would all be included. And our strategy to pass our one issue, we do ballot measures. We've done them for a while. We've done 69 in all, including the 11 we did in 2024. The 2 districts in Massachusetts that the current occupant of the White House carried also passed the Medicare for All non-binding bill. We do municipal resolutions. We're in Fitchburg tonight. I did a presentation in Lowell for one of the groups there a few weeks ago. And we also, smaller municipalities have been doing it through the last few years. We have a municipal calculator that shows the savings. We also do grassroots organizing and state house action. And Katie and I have both testified at many hearings. And I think that's all I'm going to say. We know that there's a better way. And we are the state with the right size. We have the right economy. We have the revolutionary spirit to be able to see that this can be done. Thank you very much.
So you can be my IT.
Yes, I shall.
Thank you very much, Kimberly. Yeah, and I think at the end there, Massachusetts, we're leaders. We're
Right.
consistently leaders in this country. We don't always get the credit for it, but that's okay. We don't get the credit. But we consistently lead, and we have an opportunity to do so. And Fitchburg has an opportunity to do so as well by passing this non-binding resolution to support Medicare for all here in Massachusetts.
Thank you.
There you go.
Yep. Thank you. I want to thank Councilor Cruz, Councilor Schultz. I thank all of the residents of Fitchburg, and even if you're from elsewhere, thanks so much for being here, as we're talking about this topic. So my name is Katie Murphy. I'm the president of the Massachusetts Nurses Association, and we put this PowerPoint together a few years ago, and I pull it out occasionally and looked at it and said, it requires no updating. Nothing has happened. The bill numbers are out of date, so don't look at those. But, I pulled it out, nothing has changed. So, we represent over 25,000 frontline nurses and healthcare professionals. And so I'm talking about people who are in visiting nurses associations, home at health. So these are occupational therapists, physical therapists. So we're very proud that we have so many more healthcare providers. But we are on the front lines. We're on the front lines, and we're seeing every day, probably what you're living, what people are experiencing when we don't have the care that we need. And it really stems from our belief that health care is a human right. Simple as that, and it's in our code of ethics that we have to provide the highest quality care for all of our patients. And so when we see that patients are coming to us and not having gotten that care, the answer is, a global single-payer system where everybody can get the care that they need. And we're supporting it. We've supported both in Massachusetts and nationally. And the position statement of the World Health Organization is that the highest attainable standard of health is a fundamental right of every human being. And as I say, and that's where we come from. And so probably all of us can tell stories about denial of care, really injuring patients, maybe sometimes even leading to death. Right? So it's very, very personal to us. And also we agree with Martin Luther King Jr., who said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And it really is. And we see it every day. And so what we believe that Medicare for All will provide is access. Can you get the care you need? Everybody alluded to it, that if you have insurance with, a prohibitive deductible, you might have insurance, but you can't get that care when you need it. And will you go bankrupt if you do utilize that health care? That's the leading cause of bankruptcy in the United States is medical debt. Now, we hear at least once a day that we have the best health care system in the world. That's a statement made without any evidence. Quality, will you survive your encounter? And I'll talk about it a little bit more, that when we see institutions placing profits over patients, Stewart, and many others, that patients can be in danger, and that's something that we're also fighting for. And equity, do you meet special barriers to care? And I think Neshoba is really a great example of that. If you live in Boston or in that area, there are a lot of hospitals, within arm's reach. As soon as you get out of that area, around this neck of the woods, on the Cape, Western Massachusetts, there are real barriers to you getting that care that you need. So when you look at how our best health system in the world performs, we find that it fails on nearly every account. And of course, this is like a little graph that you can't even see, but sorry. But what it talks about is that other industrialized nations that they have different forms of a single payer system. It is different, but we spend more and we have the worst results. We have the highest of the industrialized nations. We have the highest infant mortality rate. We have the lowest life expectancy, and from what I can gather, all these numbers are getting worse. And we have the highest preventable mortality rates. And what are some of the drivers of this? As we've said, it's the focus on profitability rather than patient care. It's a system dominated and dictated by private insurance relying on employer-based health care, premiums, that we've also talked about. And we another driver of this is also hospital corporations, pharmaceutical companies. Again, we pay much more for medication than the whole rest of the world. Somebody's making a good profit. Long-term care and mental health providers. Here in the Worcester area, last year, 300 long-term care beds were lost because they weren't profitable. I mean, the owner said it's not profitable. So what happens is that then patients who need that care stay in facilities, and then when you go into the hospital for any reason, you sit in the emergency room, maybe for a few hours, maybe for a day or two, because patients are sitting there in those beds waiting to go out because the long-term care beds were not profitable. And a system where patients and residents are victims of and not the stewards of this vital service. We, I think, certainly the Massachusetts Nurses Association and all of us believe that, this is, everybody should be getting this care. And so what we're finding also the impact on our society is there are still 30 million Americans without health insurance. 45 million are underinsured. The insurance costs continue to rise. And having once been an elected official in a municipality myself, I do know exactly, with Prop 2.5, which, puts that decision in the hands of the taxpayer. And we were so excited when Genzyme built a new facility in our community. We said, great. That's a new cop car. Those are smaller class sizes. We can fix our library. No, Blue Cross Blue Shield took everything but $2,500, right? And that goes to roads. And again, where's that money going? I think it's going in the pockets of a few, when really it should be benefiting all of us whose dollars those are. Those costs continue to rise, and medical debt is the leading cause of bankruptcy. What we're finding also, if I can bring it to also back to the bedside, which can affect you, is that as hospitals place profits over patients, now they're cutting corners. There are fewer healthcare providers. And it's certainly the nurses and the respiratory therapists, and more it is the physicians as well. You can see that more and more of them are joining unions. One night, I work at an academic medical center in Boston, and we were, a hospital in another state actually wanted to send us an 18-year-old who had been in a car accident, who needed our higher level of care. We said, sure, we were all ready. And then, the patient isn't coming, the insurance won't pay for the transport. I remember looking, but the whole night, the whole healthcare team, the doctors, the nurses, the therapists, that just sat with us all day. I work at night. All night, we just and that is part of the cause of driving professionals away from the bedside. I won't even go into the nursing shortage. But that kind of moral distress is, physicians are going into business. Healthcare providers are saying, I can't do that night after night. So, and that really that impacts everybody in this room and the level of care we give. We're finding, cost cutting and the resources that we have to provide to our patients. Just do the best you can. Just do the best you can. With the hurricane down south, we all of a sudden had no bags with intravenous fluids. Again, best healthcare system in the world. And we were rationing IV fluids. So again, a statement without evidence. Let's see. We're finding, that patients have to wait longer for care. I agree with you when we hear the argument, well, if you go to a single payer, you'll be waiting in line. That's like, anybody been to an emergency room, tried to get into primary care, trying to get a procedure done, we're waiting in line. Patients going without needed treatments, the days of people cutting their pills, actually really not getting their care that they need because they can't afford it and don't want to use their benefits. And the mental health issue is, the behavioral health. Right on the table right now is closing mental health beds in Massachusetts. We actually need more behavioral health beds, right? So, let's think about what are we providing to our communities? And so what our solution is, this is just a cartoon that says, we've tried every single fix the insurance companies allow, and it still won't fly. And it really is. We're really at the mercy. And so we do believe, and as we agree with former President Barack Obama, that a single-payer system is what's required in this country. And you guys have talked about, what's covered. Why would hearing, teeth, and vision not be covered? You don't have your teeth, you're not eating, So that I think alone, makes the single-payer Medicare for all system a great benefit to all of us, that, we're going to the dentist, we're getting that wraparound care that we need. We feel that this will, we know it will save billions of dollars just in Massachusetts. And again, and that's money that goes back to your communities. It eliminates barriers to care. And as everybody alluded to, it will keep hospitals open. I really do believe that when UMass closed the Leominster Maternity Hospital, there was no way you could look at that in any other way than this was profits over patients. And then what happened the following week, where there's those devastating floods that actually washed out the roads. So in real life, we saw how dangerous it was to a community and in a part of the state that was really trying to, it's more affordable than other parts, and I know the municipalities worked tirelessly trying to keep both the maternity unit and Neshoba open because, we want to attract people to, our neighborhoods and our communities, so you need a full-service hospital. We also feel, as a union member, that once we get health insurance off the table, like right now we spend a huge amount of our time, we even take strike votes over whether our insurance premiums are going up. If we get that off the table, now we can start fighting for, good working conditions, making sure we have enough health care providers at the bedside. It's amazing to think how much time and effort that takes up. And even with our, our physician colleagues who are unionizing, that's a big part of the issue that they're dealing with, is their health premiums. And so we are grateful to the members of the Fitchburg City Council and the community for, listening to this presentation because, as you know, this is how it started in Canada. One province made it happen. And then, right, why reinvent the wheel, right? Then in our case, other states can follow our lead, and we have been leaders, and it's time to get this done. So thank you all so much.
really, it's you know, if you're going to fix at the best, a very bent out of shape system. I won't say broken, it's broken, but I said broken. If you want to fix that, you know, you really need to have big systemic change, and that's going to take a lot of effort and a lot of push from everybody. So thank you all for coming here today and listening, and thank you my panelists for coming as well and sharing their expertise. And there's a lot of misconceptions, I think, about single-payer health care, so we're going to open it up to the floor, and we're going to clear some of those up. I don't have a cush ball to pass around, so we'll all just have to sort of be polite to each other. Ms. Wetchy.
Yes, I would like to know if Senator Cronin and Representative Kushmerick support your legislation.
So Rep. Kushmerick will be a co-sponsor on the bill again this year. I can't speak to Senator Cronin. You have to email him for that one.
Maybe one of his staff should tell us.
I'm not representing John Coleman tonight, I'm representing the city council. And I have not discussed this with Senator Cronin yet, so I don't really have any. Okay.
Thank you, Councilor Walsh. And we also, Mayor Squalia has joined us. Thank you, Mayor Squalia, for coming today. We appreciate you joining the conversation. And I think, was that Miles out there too? Yeah, thanks, Miles. Miles, the Deputy Chief of Staff, is here as well. Well, again, a really great turnout from the City of Fitchburg tonight. Thank you all for coming. Councilor Walsh.
I have two things. A couple of the problems that I see are the number of hospitals closing and the number of people, the shortage of doctors, nurses, and other healthcare professionals. How does this directly affect or improve those two situations?
Sure. Well, and I'll on the nursing piece, I'll defer to Katie. But yeah, I think one of the challenges is that if you look at hospitals that have a large percentage of mass health patients, the reimbursement rate is lower, and under a single payer system, the state government would have the power to increase those reimbursement rates, and so that would likely lead to much higher reimbursement rates. So, you know, I will say one of the challenges with the Neshoba Valley Medical Center is that you had a larger percentage of people who went there that were less well off, and you know, I'd be the first to highlight my district is, you know, a bit of a tale of two cities, as I represent, you know, Sudbury, Whale, and Acton, mostly served by Emerson Hospital, where you have generally more people that have private health insurance, so that the reimbursement rates are higher. And so that's why that hospital is generally in better fiscal health. So that would be a big change. And I will say, I think Kimberly noted it, is on the prescription drug costs. You know, that would also dramatically change things because you'd have a bulk prescription drug program. So that would make the cost of drugs more affordable, including for, you know, hospitals that are often dispensing the drugs. So, thank you.
And if you wanted me to respond to the myth of the nursing shortage and the physician shortage, we actually have more nurses today in Massachusetts than we did pre-COVID. You know, look at all the schools and universities we have across Massachusetts. We graduate about 3,000 to 4,000 nurses every single year. The question is, again, it's a hospital's bottom line. If they can hire somebody for 24 hours, not pay benefits, and prorated insurance, that's cheaper than hiring somebody full-time. And you know that people are graduating from college with enormous debt. People want to get good jobs where they can pay their bills and maybe even sometimes own a home. You know, and I did allude to the moral distress, which really is driving people away from the bedside. And that's all providers, nurses, doctors, occupational therapists, that distress, and also the rising violence in healthcare situations, again, is affecting everybody. And until hospitals really look at that and put something into place, that's also driving people away from the bedside. So we've got the professionals, and we've got very, very high quality right here in Massachusetts. We just have to create the circumstances in which those professionals will stay and work and contribute to their communities. So great question.
Not be stuck in per diem.
Thank you.
Yes.
If we cut this presentation, we like what we hear. How can we get involved and help make this happen?
I'll answer that one. You can contact the members of the Legislative Affairs Committee who will be taking this up on the 18th and share that you are in favor of this, and let them know. Get in their ear and say, I support this, and I hope you will too.
And if I can add to that, also contact Senator Cronin's office, ask and encourage him to co-sponsor the bill, and thank your representative for doing so. I know that he intends to do so, as well as you're more than happy go to masscare.org and sign up. We'll be doing a lobby day, and we have a sign up right there. Patty's got one, and we'll reach out to you. Thank you.
Patty.
I think numbers, but every city in town will realize a huge savings under Medicare for All Massachusetts, and there was a number.
I put it on Facebook,
Almost
yeah.
$20 million.
I think it's like 19 and change.
$20 million.
Yeah.
Per year.
Per year, yeah. In Fitchburg.
Yep.
Amazing.
It is how much money would be saved, and this is we use the data from the Department of Revenue, but if you get your city comptroller to actually put in real numbers, I bet it's more.
So Fitchburg is $19 million.
That's 2022.
That's not right?
That was
How much we spend?
No. That's what we would save.
Oh,
Much
it doesn't
Well, I
even-
mean, we spent, our budgeted is $21.5 million this year, which is 26.5% more than what we budgeted last year. Last year, we budgeted $17 million for healthcare, which was already significantly higher than FY23.
It's
FY24 to FY25, we're talking about a 26.5% increase. That's unsustainable. And right now, we had to raise rates 19%. 19%.
That's for you to pay employees. Is that what that means?
Yes, that's the City of Fitchburg employee healthcare, right? We're self-insured, so we have the Fitchburg Healthcare Trust Fund. Now, a healthy balance is 3 months of, that fund balance. And we estimated that we would need between 19 to 21% increase, which in City of Fitchburg pays 75% of that. So we would estimate we need 19 to 21% to keep that at a 3-month cushion. Right now, we are at 1 month. So we are at a devastating level right now in our healthcare trust fund.
Yes.
And how does the City of Fitchburg budget for that?
Right.
We raised property rates 2.5% max.
Right.
And we're going up 26. We went up $4.5 million. We had to use one-time ARPA interest fund.
Yep.
We used all our free cash. We had to.
$3 million.
Free cash?
Most of it,
We
right?
had to take a loan out for a fire truck that we had paid for in free cash 2 years ago, still under construction, just so we can pay for these one-time benefits.
It was
that are just continuing to climb out of control.
It was $3 million shortfall in our last budget.
It's just Pittsburgh.
From the taxpayer's pocket to the insurance executive.
It's money that we could use to pay for the DPW, to pay for snow and ice, to pay for police, fire, schools.
Exactly.
Roads.
Exactly.
Mayor Squally, it sounds like we have your support on our resolution. All right.
That's great.
Would benefit from this immensely.
So,
$25 million in our budget alone, and it's probably $25 million.
But you know what? It's not just the city of Fitchburg that would benefit. Every resident would benefit because your premiums are going up every year from the insurance companies.
Yeah.
So it's.
Dan, could I get some screen time here? You're the man. Oh, I'll say no. And if you don't take my word for it, I love this little Jon Stewart clip. It's about 60 seconds. There might be some cussing. I apologize. Hold on a second. Let me turn it up. Can everybody hear it?
Here's how the system works. You pay taxes to the government pools that money and uses it to provide the people with essential goods and services that they need. In this country, we've got a different system for getting the things we need. Take healthcare. We pay taxes to the government, and the government gives our money to a middleman, for-profit insurance companies or for-profit health providers. And the insurance companies provide health coverage in exchange for maybe some more money from us, and a deductible that covers not everything, certainly not your teeth or your skin or your eyes. It's a pretty good system if you own an insurance company. Companies like United Health and Aetna collect 70% of their health plan revenue from government programs. Humana, 90%. These health plan businesses would not exist without our tax money. And it's not just healthcare. It's pharma, oil and gas, higher education. Taxpayers subsidize these industries and then take their profits, and we still pay so-called free market rates for their product. It's a classic double dip.
Yep. So that's basically, I mean, he's brilliant. That's basically the gist of it. Yeah, we'll get to big pharma and oil and them eventually, but for now we're going to go with healthcare. Yes, Liz. Director Murphy.
So we talked a little bit about what the city of Pittsburgh would save. I don't know how the 7.5% or 8% for employers' costs, if that would translate to savings for them from what they're paying now for their premiums. But if it does, or if it can, I feel like this is an opportunity for us to be competitive in attracting employers. It's something that we're struggling with now. Our costs of housing are so high. We have these other costs that are so high. So we know that people leave and go to other states that the costs are a little bit lower. And I'm sure that employers are thinking about that too, and whether to stay in Massachusetts or go other places. But this gives us that opportunity to attract them for something. This could be a real economic development drive.
Good point.
Great point.
Yeah, if I could just add, I think that's why part of the campaign is to get more, often small business owners to get behind the legislation, because that really will help move it on Beacon Hill. So
it makes a lot of sense because if you want to think about being an entrepreneur, the first thing you have to think about is, well, does my spouse have health insurance and I can go out on my own or not? Because I know I wouldn't take the risk.
Yeah, a lot of people stay.
But I wouldn't take that.
A lot of people stay in jobs because they have health insurance versus trying something new.
Been going on for years.
So we've heard compelling arguments for this, not for the first time, 16 years, you say. Can somebody address the opposition to this? Because I've been to a number of hearings, and this is kind of a level question. Hearings at the State House where it doesn't even get out of committee.
Right.
I mean, hello? So it's like talking to this wall. So the opposition is twofold,
I think there's a lot of misconceptions, and I think these insurance companies have the money and the power to drive those misconceptions home. And I'm glad you are all asking really good questions, because I wasn't sure if anybody was going to ask questions. So I actually grabbed some off of the hellscape that is social media from when I posted this. If anybody wants to hear some of the comments, we can address them. I'll keep the cussing out of it. So you already explained how. The big one was, how are we going to pay for this? I think Senator Eldridge, you did a good job explaining that. Someone put, I like my private insurance, that's a stupid idea.
Who likes it?
I know.
I don't know.
Then I care,
Everybody likes it until they go to the, and I'm a nurse.
Yeah.
Everybody says, I have great insurance. A lot of people say that. You go to the hospital, come out with that $2,000, you don't have it.
This is Patty Healy. She's also with Medicare. She helped put this whole thing together. Thank you, Patty.
If I might add to that.
It's all the insurance company.
Indeed. And if I might just add, not only does your private insurance cost a lot of money, if you have a catastrophic illness such as cancer or a heart attack, you're expected to pay $8,000 out of pocket as a co-insurance. It's written into the system. Your private insurance doesn't take care of that. That comes out. This is how people lose their houses when they get ill. Thank you, Derrick.
Well, of course, thank you.
Follow-up question to Councilor Wall, who's also my wife. And I'm also on the school committee. I understand part of the negotiations was dealing with the health insurance and negotiations that no one wanted to pay more out of their own pocket.
You're right.
To follow up on one question, I have a couple of my own. One of the big issues right now with healthcare is primary care physicians. And I don't see how this resolves. And maybe it will, but I don't know. And I don't know if now I have a primary care provider, so my direct person is a nurse practitioner. And I don't know if that's what the state is going to, that would deal with the issue of, for example, we had to change our insurance, which I'm glad we still had an option, because what we had before, I think best primary care physician no longer would take the insurance that we have.
Right.
So I'm wondering, if this passes, would all hospitals have to accept this program? And I wish you could come up with a different name than Medicare for all. People can get Medicare. I'm on Medicare. And I think it's confusing. It has nothing to do with Medicare.
It would open up, it would establish the Massachusetts Healthcare Trust, and we call it Medicare for All because it's something that people understand. It is health care for every person in Massachusetts. All private insurances would cease to exist. There would only be one way to get paid, either if you are a provider, it would be, either through the Medicare if you're over 65, and then it would also, you'd have the supplemental of the state Medicare for All system, the Massachusetts Healthcare Trust. Those would be the only two options in Massachusetts. There would be nothing else. Mass Health would be rolled into the Massachusetts Healthcare Trust. That is correct.
But the difference, if I could just add, because you asked about primary care, is it's the reimbursement rate, right? It's unfortunately lower for Mass Health, and so the state could increase that. And I will say that's also how to attract more primary care, right? Is to say you'll be paid a higher rate versus some specialty doctors. So
one of the things that came up was about denial of a process or a procedure. So with Medicare for All, there would never be any denials, no matter what my health issue was or is.
Not for needed care. And, certainly if you look at other universal healthcare systems, obviously, cosmetic surgery, that's not going to be covered, but for needed care, it would all be covered. Yep.
The denial rate was substantially.
So the denial rate for Medicare is under 2%. And what we would know, right now you don't know whether or not what you have is coming. Whereas with this, and you would know right then and there what it is, how much is covered.
In United Health, with upwards of 60%. Denial.
Mrs. T, you got a question back there?
I did. What I'm understanding then, Councilor Cruz, is you're saying that the resistance is coming from health insurance companies lobbying the legislature.
100%.
So that's the only resistance, because I wanted to add a comment too. I think it's important. Nothing is ever black or white. There's gray in universal system. And I think it'd be important to bring up those points, because my sister in New Brunswick needs knee surgery. She waited 2 months for the appointment, and she's on a list for next year to have that surgery, and at least a year out.
That's what I hear. And I have known it goes across country.
Yeah, I think the first is, different countries, we're hearing a lot about the NHS in Great Britain because, this is, what's frustrating is there's cuts to NHS and then there's delays, right? So part of it is fully funding the system, which I think Canada is trying to figure out right now as well. But the overwhelming majority of Canadians like their healthcare system, yeah. So, but I acknowledge there are delays to what Kimberly said earlier. Here in America, there's massive delays on many types of healthcare, right? So, so no system is perfect, but I think the universal model, provides better care, and that's shown in the age that people live in other countries and the low infant mortality rate and other things. So, I was just going to add to other opposition is obviously big pharma, right?
Yes.
So big pharma is opposed because unlike other countries, although it's got a little bit better under the Biden-Harris administration, is the lowering cost of prescription drugs and getting into bulk purchase of prescription drugs. So and pharmaceutical companies are opposed to that. So they're opposed to single payer too.
Some of these pharmaceuticals, right, for the city of Fitchburg, some of them cost over $2,000 each one. And some people need multiple of them a year.
Right.
With thousands and thousands of dollars for one medication. It's really out of control. And you don't get these kinds of things in not these for-profit systems.
Right. And it's not just the pills, right? It's epinephrine. It's all of that stuff. Inhaler, exactly, yeah.
And if I could add, because I'm sure a lot of people here saw the Super Bowl. Did you see the pharma prescription drug commercial during the Super Bowl? And, child being hugged by a parent or something because they were saved from a difficult disease or healthcare challenge. Those drugs, it came out a little bit on social media today, one of the drugs was $22,000 a month. Yeah. So that's,
and one of the things
great, but
and one of the things that drug companies do is they say, well, if we don't have the system we have now, that we're not going to develop any new drugs because we won't be able to do that anymore because we need that profit margin.
Right. And they get your tax dollars to make those drugs. The research and development, the R&D, they get you. They're in your pocket, their back pocket, your front pocket. They're in your bank account.
Exactly.
We're here.
If I could just one thing that's just particularly I shake my head is a significant number of these prescription drug or pharmaceutical companies are from countries that have universal health care, right? Indeed. So, it's hard to believe, but it's true. Yep.
They create so many diseases that they can create.
We may need a Cushball after all. This in the back.
I wanted to speak a little bit about the issue of physician availability that might be improved with universal single-payer health care. I'm here tonight. I live in Worcester, but I have worked in Fitchburg since 1999. I have worked in mental health. I consult primary care. And so much of what we do on a day-by-day basis, documentation, prior authorization, does this one have insurance? I'm seeing somebody tomorrow in clinic down the road who stopped seeing everybody for 6 months because their insurance lapsed. Even in Massachusetts where we have 90, so what it doesn't count is like the churn rate. You can lose your health insurance, you lose your job, you make $2 too much and you're kicked off of Medicaid. You don't even know it because your address changed and you didn't get the notice. So we have a lot of people that are very much underinsured. Primary care doctors work their tails off trying to sort of make things work. And if we didn't have to worry, like I saw somebody, I'm a psychiatric consultant, I saw somebody who was very suicidal, a parent, needed to be seen very frequently for the next couple of weeks, and had the kind of insurance that the system was no longer going to take, which I think many of us have heard about in this area. And I'm like, you got to see this person. I don't care if they have insurance or not,
Right.
So, anyway.
I think that's a good point of why you use this burnout and this high turnover rate. I mean, you have physicians and nurses swearing an oath that they're through no fault of their own, they're struggling to keep. You know, that's got to be crushing. Al.
How many of the drug commercials do you hear that the side effect?
Yeah, I'll take the headache over the side effects sometimes. Yeah.
Depression, it's suicide and depression if you take the drug for depression.
Well, they got another one for that too. For the side effects, they got another one for you.
You could have taken another drug.
Yeah.
Here in Pittsburgh and whatnot, I see a lot of the primary care physicians that are around retiring because there's no one coming up behind them.
Yeah. Trevor and then Miles, please.
Hi. I am the chair of the PEC, which is the Public Employee Committee that negotiates health care for all the employees of the city. And I've been doing it for 15 years. And we're in a crisis. I want to support what the mayor is saying. We're in a crisis in Pittsburgh right now. We have, in good faith, negotiated for 15 years now, and we're at a point that insurance has cost too much for us to compete and to have good health care. And it's coming to a situation where we're at odds with the city from a union labor standpoint because we're trying to maintain some form of health care that we can all afford, both the city and the employees. And it's going to break like this year. We've done it for 15 years. It's this year that we're going to lose it all if we're not smart and make good decisions.
And we're not alone.
As soon as possible, it'd be wonderful for the city and for the labor.
Thank you for that.
And if I could just add, I should have mentioned this earlier, but in addition to getting more small businesses to support Medicare for all in Massachusetts, to get more unions to support it is critical. I mean, M&A's been incredible, but to get more unions, especially local unions, to support it would be helpful.
If I might say, what happens often in primary care when someone has a high deductible on their, not only their care, but a high deductible also on prescription drugs. They're avoiding treating themselves, using that as an inhaler, and then they're getting really sick. They're not taking medication, and then they have to go to the ER to get dialysis. And we're kitchen sinking it at the end and spending a fortune on caring for people. And I spent 3 hours today doing prior authorizations, fighting with insurance companies, and my thrill is to win. Take those hours that I spent working on prior authorizations and fighting with insurance companies to give patient care. It'd be a world of difference.
Right, exactly.
Miles.
I was just going to give you a chance to answer a question that I get sometimes in this matter. When you're planning on projections for a system like this, how do you account for the potential increase in demand that you might see? I didn't catch your name, but you mentioned there's a lot of people who are underinsured or not satisfied with what they're getting. If they get a potentially better system, there's probably 13 things on me right now that get checked out, but I'm not because I'm not satisfied with my insurance. Do you account for potentially everyone saying, this is a better system, this is working well, and that being an influx of demand, and how do you prepare for that when you're looking at numbers from today? How do you account for what might change based on people being better insured?
I would say you want to look at it the other way is, you want to meet the demand of people what they want, right? Right now we're cutting off demands due to profits.
Studies that will show that expanding a highway doesn't necessarily slow traffic. It just makes more people want to get on the highway, want to get more cars. And so potentially,
I guess what I would say, and it sort of speaks to your name, sir.
My name is Jamie Eldridge.
Yes, is that if people are delaying health care, then what's going to happen is you get worse. Then they're going to an ER, which is even more expensive. So if you address, the health care needs up front, whatever they are. And the piece that I think sometimes gets a little bit missed is that, we have a model that's treating people because they're not taking care of themselves, bad nutrition, not eating well. And if you had a public health system, including investing in every public health department in every community, you'd have a much healthier community than when they're in their 60s or something, having a heart attack and needing more invasive surgery. So that's partly how you save money as well. But we want to meet people's demand, and if that means hiring more nurses or doctors, then that's the system we should have and deserve.
And if I might add, there's no question that people should be able to get health care, and that nurses and physicians should be able to work their positions without someone saying, no, you can only do this for so many hours. If they are open to provide care at all times, in all facilities, more people may use the system, but there'll be more system to use. Right now, we have a limited system that is overwrought and overworked and understaffed because profits become before people. You're welcome.
I think there's one, and I thought it was MGB, that there was one person working in the billing department for every bed in the hospital. Not a healthcare provider for every bed, not a nurse for every bed, but a billing person. So and we have language about just transition to retrain people, but then if you're not paying however many dollars for those people working in the billing section, then that money is available to provide that care. And if you go into the hospital with a cut on your leg, that costs far less than having to go in eventually and get that leg amputated because of infections. So yes, it's exactly what you're saying. People will get that care far earlier.
And it speaks volumes about our priorities that we have one person doing the billing per patient and we can't put a nurse for that one person.
Yeah,
what does that say about what the purpose of healthcare is? It says it's to make money. Ms. Lecce.
Have you sought or received the endorsement of the Massachusetts Municipal Association?
The MMA.
No. I don't know if we've presented, so yeah, we should do that.
What is the director's job? Isn't he an insurance executive?
Well,
we are recording.
Yeah, right. All right. Just it was a question.
That's good.
As Jamie said, with one person spending 3.5 hours, that he could have been working with a bunch of others. How many other doctors are spending half their day, if not more, trying to do the paperwork and not do the care?
Right.
Exactly.
Fitting your problem into a code so they can Yep.
So we're over 8. We thought we'd get our awesome panelists for about 90 minutes, and we're over. Do we have any more final questions or maybe some feedback about what they can do to get involved, how to get involved, how to push this over the line? And like you said, Senator, you've been filing for over a decade now, so every little bit helps.
16 years.
Yeah. I mean, this is an incredible turnout, so thank you so much, Councilor Cruz and Councilor Schultz, for sponsoring this, and great to see the mayor and so many councilors here and union leaders and medical professionals. I would say, and I don't want to take too much of what Kimberly advocates for, but we're trying to create these sort of chapters, if you will, right, for mass care. So it'd be great to have something in this area. In my area, we've had a single payer group for many years. So that's certainly helpful to get behind the bills. And I guess I would say that I think sometimes the focus on passing a bill is just getting legislators to co-sponsor a bill, and while that's certainly helpful, it's just that this movement has to be a lot more in-depth and sort of layered to really create real change on Beacon Hill. So to build that sort of movement here would be really powerful, and thanks everyone for coming. This was incredible, so I wanted to be here with you tonight. Thank you.
Thank you.
And if I could, thank you. If I could add to what Senator Eldridge said, I am told on Beacon Hill every day that they never hear about single payer. No one calls. No one ever calls them about supporting Medicare for all.
Right.
Call every day.
Yes.
Call everyone and tell them that health care matters to us and that we are stuck in a broken system.
And then call your union leaders. Call and have your unions endorse. Yes.
One quick round of applause for our awesome panel here, Senator Eldridge, Thank you, Councilor Schultz. The next thing for us is to get this resolution passed. Madam Chair, you will be at the Legislative Affairs Committee running the show next week. And
your mayor is here.
And we have the mayor's support. And this is Bernie's meeting, so I'll let him.
I was just going to say the next City Council community meeting will be held on March 10th, and we have the new Police Chief Giannini coming, as well as the fairly new Treasurer, Ms. Horn, coming. So I just thought I'd let you know that'll be at 6:30 right here in this building.
Yeah, stay involved. It's great to see all of you here tonight. Thank you so much, really. Thank you for coming.
Thank you so